One of the great things about this program is the culture here at Gunderson. The Medical Education Office really prioritizes resident education and our well-being. The 5 months of electives that we get really give us the flexibility to get out of this intern year what we want, and really it allows us to tailor our education with the hopes of preparing us better for our advanced residencies.
I found at Gunderson that all of the consultants and specialists that you need to talk to are super friendly. Nursing communicates really well, been able to get stuff done for patients quickly, which I've really enjoyed. And I've just found like the environment to be really supportive. On top of that, I just really like living in La Crosse with the bluffs to go like trail running, people go mountain biking, and just the river's right nearby. Just a lot of stuff to do. Downtown's pretty cool, so just found it like easy town to get around in, and just really enjoyed all of the outdoor activities here.
My favorite thing about being at Gunderson is actually the housing. I really love living next to all of my co-residents. We're able to get together all the time, which I really enjoy. We can get together right after clinic when work is done, or on the weekends. We go hiking together, biking, canoeing, go to local breweries. It's a really fun time and a great way to spend my 1 year here for a transitional year.
So I came to Gunderson because of the excellent patient care opportunities, the strong training, as well as the focus on resident wellness. And I love the state of Wisconsin. I've lived in Milwaukee for the past 8 years and wanted to see the state on the other side.
I came to Gunderson here because of the flexibility the schedule allowed me, and just the area. Love the area that gives you plenty of opportunity for outdoor activities and other fun things to keep you occupied outside of the hospital.
I'd heard great things about the program from my friends who had trained here previously. When I came here, it was the well-rounded clinical program in a collaborative environment that I knew would train me well for a future career in dermatology that attracted me to Gunderson.
I was talking to previous graduates of my medical school who came here. They had very high praise for everything that Gunderson had to offer, for the quality of the teaching and all the subspecialists that we get to interact with on a daily basis. They said that there was countless times that different subspecialists that they came across would take time out of their day to teach different small points pertinent to their field, just to add to the education we were getting on our core rotations here.
I chose to come to Gunderson for the diversity of clinical opportunities here presented for transitional year residents. And I have enjoyed the collegial environment to learn about medicine and continue to practice my skills.
My favorite thing about this program is definitely the people, especially my co-residents. They are amazing individuals, we get along really well, and just in a couple months' time we've already made some solid bonds.
So far I've enjoyed the teams, the people, really enjoyed living on the campus housing as well. Being close to the hospital is just an amazing convenience. Beyond that, I really enjoyed the electives. I'm super flexible, so I can choose my own adventure in residency.
I also heard so much about the community aspect of Gunderson. Any intern year program is going to be really difficult, so it was just that much better knowing that once I was here, I would have not only a phenomenal program director, but also faculty and staff, as well as my co-residents who would always be there with me whenever I was stumbling. And it's now been just such a relief to know that, you know, every time I've stumbled, they've always been behind me.
I wanted someone with a strong transition year track record, with a solid culture and support system. It's a big jump coming from a medical student and going to be a resident. And I think that all starts with the program director, Dr. Weber. She's always there for us 24/7 whenever we would need help with anything. I've also had a great interaction with all the attendings and senior residents on my rotations. And finally, most importantly, all of the fellow interns in our program have just been wonderful. If I had to do it again, I would not change a thing.